for tuning in to Sapphire Snuggles Resource Zone TV. Today we're talking about baby's first tooth and 7 facts parents should know. So I'm here to tell you how to care for that first baby's tooth. So as we know, most babies will develop their teeth between the ages of 6 months and 12 months. Some may even come earlier. We just don't know. Every child develops at their own pace and in their own space. So let's go from here. So we know most babies will develop their first tooth depending on, timing and everything. But it's typical between 6 months and 12 months. First tooth usually appears at the bottom. That first cut, like right here. Around maybe 2.5, 3 months of age, babies start doing a discovery where they're kind of fisting their mouths and discovering their hands, and also drooling so much. It's a lot of drool, it's a lot of bite down, clamping, and all they're doing is just feeling the sensations that they get in a sensation that something is popping through their gums, and it's something probably sooner than later. So don't get alarmed. Your baby might be hungry or whatever, but you will be able to decipher the cues as they get older. At about 6 months of age, you should introduce fluoride into the baby's diet. And fluoride is a mineral that helps by hardening the enamel of the teeth. So with babies still on that liquid diet, and we're slowly introducing acidic foods, fruit and veggies. So we want to make sure that the tooth enamel is going to be strengthened as they're being introduced to more foods and more drinks into their diet. Massaging sore gums, offering something cold. We know there's a bunch of teething rings out here on the market. Tylenol. That will be your best friend. That will be your best friend during this teething time on occasional rough nights. That can help with your baby's teething pain. I truly don't recommend the Tylenol every night because they have to bear with it sometimes. But if it gets totally unbearable and we don't like to have our babies in pain, just give them the dosage and just help them along with the pain. Now, cold passies. That is my number one to go. I always freeze passies, and if they're having trouble throughout the night, I'll give them the cold passy out of the freezer. Do not use teething tablets, gels with benzocaine, homeopathic teething gels with benzocaine. Belladonna and benzocaine are marked to numb your child's pain. But the FDA has issued warnings against both, claiming potential side effects. So please beware and read the ingredients. Read all ingredients when you're getting teething products and teething gels. They all may say that they don't contain these things, but always read your bag. You should brush your teeth, your child's teeth daily. That means twice a day. After breakfast and after their last meal with fluoride toothpaste. There's nothing wrong with that. So once your child has their first tooth, you should start brushing them twice a day with a smear of fluoride toothpaste in the size of a grain, especially after the last food or drink that they have for that day. Remember not to put your baby to bed with a bottle. That can lead to extreme tooth decay. The juice or whatever milk or whatever lays in the mouth, and we don't want to have it right at the teeth enamel. Number 6, so ask your pediatrician about your baby's teeth and a fluoride varnish. During regular child visits, your pediatrician will check your baby's teeth and gums to ensure healthy and talk to you about keeping them that way. So always listen to the instruction of your pediatrician and dentist, and they will make a world of difference. It's a lot of things parents don't know that they're doing it can harm the kids' teeth. So always, if you're unsure, just consult your pediatrician or your dental provider. Make your child's first dental appointment when their first tooth appears. Try to make your baby's first dental appointment after the eruption of first tooth or by his or her first birthday. So very important that we just keep our dental health up, because dental is the way to our gut health. So if we start our children off young, they will definitely have a period of good gut health and dental health. So just try to make that as a reminder in a parent mental. And I know it's so much going on, so much you got to look for, but I promise you it will become the norm. Promise. It may seem hard, but it is. So anywho, remember, first tooth eruption, and you'll usually feel it just a little, like the top of the tooth. Make that first appointment. And if you just don't feel comfortable with that first appointment at that time, make sure it's done by the first birthday. So hope this information was very helpful, and make sure you remember your dental health, it all goes down into the full body, whole health regimen. So thank you. Let's get those babies' dental appointments done. Bye.